Hello. The purpose of this recorded slideshow of the presentation is to provide the opportunity to all of you that could not join us on September 5th to view the presentation, move together on our next steps, and request to please mark your calendars for our next meetings. Hope you find it helpful. Welcome to the launch of the Social Project for English Language Learners. We are gathered here today to provide a space for all participants to meet, share a common agenda, and also an opportunity to answer any questions that you may have. I am very proud to present this project to you. It is a collaborative project that emerged with your support and the hopes of many students and families. My name is Zoila Ricciardi, Project and Budget Manager for the Office of English Language Learners. As a Latina, Hispanic, mother, immigrant, and public servant, this project is dear to my heart. It has provided an opportunity to link my community service, immigrant background, and professional experience, and in the last 4 years in public service. We believe so strongly in this project that our goal is to expand its reach from 5 BPS schools to 134 by gathering as much data as possible that could help us institutionalize the process and place BPS as your preferred placement for future interns. Before presenting the agenda, I thank Dr. Mari Benazar from the Massachusetts School of Professional Psychology for hosting this event. The agenda is as follows. We will share your vision and mission, the objective of the project. We will have we had an ice-breaking exercise, meet and greet, a summary of project of activities, an overview of SIFE students, project background, preliminary finding of high school Spanish speaker students and families, an executive summary, areas of concentration, next steps and next meetings. Outside of tests and exams in the classroom, there are conditions that influence our students that are often difficult to understand and measure, but are not, though, any less important. In this project, we wanted to emphasize all the social conditions that directly and specifically affect immigrant families and students, using a holistic wraparound theory of change commerce approaches that mobilizes the support of community organizations, nonprofit, local governments, and private institutions. We are attempting to walk in students' shoes and begin the process of understanding them better as people in particular lived experience. The objective: working together to create a holistic and collaborative program model per school that looks after the socio-emotional, socio-economic, family and academic needs of the most vulnerable ELL students in BPS. We prepared an icebreaker exercise to get to know each other a little bit. Participants joined a group based on the school that they were connected to. Participants enjoyed 10 minutes for this exercise. Each group selected a spokesperson to introduce the team and present to the larger group. What are your hopes for this project? We have in the columns, we have team members, we have BPS schools, BPS principals, BPS internship supervisor, social work schools, their field director, education director, the Massachusetts School of Professional Psychology, social work interns, clinical doctoral students, practicum students, primary supervisors, secondary supervisors, additional support to researchers, additional support to BPS school, OELL staff main contacts. We have 5 schools in the pilot. The summary of project activities. We have put together the areas of what are we going to do, who is responsible for this task, when will this task be accomplished, number of weeks involved in the pilot, and number of hours by each group. From the clinical perspective, these are direct services to BPS students, social work interns, and practicum clinical doctoral students are involved. The period is September 2013 to June 2015. Number of weeks, 36, and the number of hours that will be provided as direct services to BPS students are 5,760 hours. From the supervision is direct supervision to social work interns and practicum clinical doctoral students by licensed social workers. There are 720 hours involved. From the research perspective, we have pre-post evaluations. Individuals involved in the process are the researcher, licensed mental health and social work professionals, external consultants. 36 weeks, and we have estimated 700 hours. How it will be measured: family support visits, parental engagement, Epstein questionnaires, family education, dropout rates, failure rate, social inclusion, grades, English level, absenteeism. Additional support to BPS schools. Schools participating in the pilot receive additional support hours from Office of English Language Learners. Who are they? Licensed mental health and licensed social work professionals. There are 300 hours of additional support to BPS schools. The following slides were presented by the SIFE director from OELL, Ewald Charles. I will only read the title of these slides, and I will let you go at your own pace. Who is a SIFE student? Overview SIFE eligibility criteria. Slide number 1. Overview SIFE eligibility criteria. Slide number 2. Overview SIFE eligibility criteria. Slide number 3. SIFE demographics. Needs of SIFE community. OELL vision and social pilot project. The following 2 slides will provide you background on the project. The first arrow shows the SIFE project starting mid-September 2013. OELL received the approval of HSR, Human Subject Research, by the IRB, Institutional Review Board, and the approval of the Office of Research, Assessment and Evaluation of BPS by the end of January 2014. Interviews and preliminary findings to Spanish speakers, students, and families were completed by May 2014. The second arrow shows what we are currently completing now, which are the interviews to Haitian-speaking families and students. Marie Bertonia Antoine, a licensed mental health professional and Haitian speaker, is performing the interviews and transcripts. The third arrow shows our next steps with Cape Verdean speakers, families, and students. I would like to use this opportunity to please refer Cape Verdean speakers, social workers, licensed mental health, or other Cape Verdean professionals. Based on preliminary findings from the SIFE project, which will be discussed later on by our researcher, we have identified 4 components on which to focus our attention. On the red circle, you will read one component is the academic piece, and a new partnership was created with the Boston College School of Education and Step Garden Institute to launch the hydroponic project, which was piloted this summer and will be implemented in after-school programs for elementary schools with high concentration of ELLs this fall. During the pilot program, ELL students follow directions, fill systems with nutrients, plant seedlings, watch plants grow. It is an engineering challenge that gave a student an opportunity to build something while learning content and new vocabulary. From the socio-emotional component was born the social project, where we will try to demonstrate, based on research and solid metrics, that the higher the socio-emotional support, the better the academic results. And that is shown in the purple piece of this chart. Slides number 16 through 23 were presented by Diana Valero, the researcher of the SIFE project we have been discussing. Diana is a licensed social worker with a degree in law and a master in public and social policies with a specialization in education. The SIFE project allowed us to interview many students and families. We visited them in their homes and in their schools. We used a communicative methodology. During the interviews, we talked with families about children's performance in the schools, expectations, dreams, lives in their home country, current problems and their community contexts. The interviews provided us with extensive information about the individuals that are behind the big data. We divided the preliminary findings in 4 components: academic, socioeconomic, family, and socio-emotional. Diana will be setting up a conference call to go more in details on these 4 components. This upcoming call will help the social work students and the clinical doctoral students to understand more about SIFE students. Academic component. Each student is different. Even among a small population as are SIFE students, there are a lot of differences. For example, the country of origin, educational background, period of time without schooling, any prior education within the US. For example, in some classes, you can find students with and without literacy skills. Some of them go to school just with the expectation of learning English to find a job, while others are more committed to finishing the high school. Each student needs a personal approach. But one thing that they do have in common is that most of them have a lot of absences and are in high risk of dropout due to factors addressed in this presentation. Socioeconomic component. One of the constants Diana found is that they have higher debts due to the migration process, legal fees, and cost of living, forcing them to take jobs at odd times of the day, contributed to high absenteeism and dropout rates. Almost all of the boys interviews work, some of them more than 40 hours a week. Family component. The family component influences the socio-emotional component, which will be demonstrated in the next slide. Some of these students have gone more than 12 years without seeing their father or mother or both. When the student reunites with his or her family, they may find a completely different family structure. Mother may have gotten divorced and is now remarried. The student has to introduce him or herself into a new family with new siblings. This situation makes them very stressed and sometimes can cause some family trouble. Socio-emotional component. Lack of strong family bonds due to separation. As we saw in previous slides, SIFE students can spend years without seeing their parents. This leads to authority problems. Parents see SIFE students as adults and have a difficult time bonding with the son or daughter. Sometimes SIFE students have to pay rent for their room, and that makes them feel more like a stranger than part of a family. Another important fact is that SIFE students socialize only with other SIFE students in the same class. This helps them when they arrive to the school, since they can communicate in the same language, they are from the same country of origin and culture. But after a while, this becomes an issue, since this peer reference group do not provide them with other interactions that could help them develop their English skills and their inclusion in the school. This is manifested in the fact that just one of the SIFE's interview participates in after-school programs with non-SIFE students. Conclusions? Failure and dropout rates are higher on SIFE students because they have psychosocial needs that go beyond academics and that directly influence their educational outcomes. Students and their families need more support from the community, non-profit organizations, higher education to get out of social risk in which they live. The school as an ideal place to link the needs of future holistically. OELL recently surveyed 189 coded SIFE students against the Mass Health Portal, and the findings were as follows. Out of 189 SIFE students, we found that 162 are listed with Mass Health. Out of the 162 students with Mass Health, 60 have Mass Health with mental health benefits, while 80 students have Mass Health without mental health benefits. Out of the 189, 42 are not listed under Mass Health at all. Next steps. I have documented the next step discussed at the end of our meeting. From the clinical perspective, by October 1st or before, social work schools plus MSPP to assist with tools to measure student efforts, if applicable. Supervision, by October 1st or before, social work schools plus MSPP to assist with tools to measure supervisor efforts. Supervisors to get clear expectations from field directors. From the research perspective, by September 15, researcher plus supervisors will set up conference call to present preliminary findings of SIFE Spanish speaker families and students in detail. The presentation will be to social work interns plus MSPP doctoral students and other interested parties. Researcher plus external consultants plus supervisors to review project plan plus measurement tools. Additional support to Boston Public Schools for pilot schools. OLL plus researcher to work with the school's coordinator to create tools to measure efforts. From an operations perspective, Zoila to coordinate BPS overview to social work interns plus clinical students. For example, resource centers, NACC, around OELL, and other BPS departments. Zoila and social work schools plus MSPP to expand pilot from 5 to 134 schools. Follow-up meetings by October 1st. Please mark your calendars. Follow-up meetings will take place on December 12, 2014, March 13, 2015, and June 12, 2015. Invitations will follow. Thank you.